started with concord and fibrin. So basically, the non-compaction is a non-compaction when the alveoli is formation, embryogenic alveoli, and the adulterated. What happens? The two-layer compaction happens. So there will multiple trabeculations which inter-races. So
in between two areas, outer layer and inner.
Outer and inner. Outer the epicardial side, inner endocardial side. These two layers, there is a remain the embryogenic of a spongy shape. So multiple trabeculation will. And this is the
which are adding within. Which are adding within.
Within that. So non-compaction is a very rare type. One in even 10 lakhs, 50 lakhs report cases are there. And having this it is a basically sarcomeric and aphagic protein defective. So titin in bonding actin and myosin filament, that is the ventricular arrhythmia, embolic events and heart failure. So patient have 18 years of age, he is only son of his wife, and he is getting arrhythmia now. Later on he might have attenuated embolic episode and gradually heart failure is the sequel. And last is echo and MRI. Echo is the blood first line investigation, but MRI is the pinpoint investigation for structural non-complex. Antiarrhythmic drugs, anticoagulant and ICD are options. So that's why we have presented in this forum that non-compaction LV is very rare, very rare. We have got once in life someone will get it.
So which antiarrhythmic do you prefer in this patient?
For God, we have
Beta blocker.
Beta blocker we are doing.
So do you think that your laboratory should be equipped that way, that you can test the type of antiarrhythmia that should be individualized for individual patients?
Basically depend on the triggering force. Because there is a mild sponginess, you are getting bisebony. At any time we make a itch. I will go next case. I have also kept for my friend for next case. Whether there is another very rare of case where I will show my case.
Thank you. Start. Next case. Brother Charles. Very good.
Second case is again second case I again student and he is having 20-year-old boy, again the same boy, age also same age of group and having palpitation and 2 episodes of condition. When he presented to our clinic, he was having one day, he was saying that he fell on in mosquito nest and having severe type of syncope and gradually he regained the consciousness and then he came to us, consulted them here and first he was normal. So palpitation often on with 2 episode of your loss of consciousness on July 10, it was a case of it. And palpitation was sudden onset, it subsided with gradually transient 2-time loss of, but it doesn't look like seizure. You're saying he is regaining in 30 seconds, immediately he is regaining. So seizure and bulbar syncope is clinically very significant. Seizure will never regain within the 10 seconds and 15 seconds. Generally it is the syncope which regains within the. So, but no significant any clue regarding the rheumatic ischemic or any heart. All are negative. So non-smoker, similarly both, we have taken the history of parental, both side parents are normal. One paternal uncle, paternal at 56, 2 paternal uncle had pacemaker at the age of 56, 57. Otherwise, this is one clue that we had wanted to get it whether it is some genetic or not. And other general examination, it is normal. 64 heart rate in that day and BP was normal. Precordium normal, sick, nothing relevancy, no murmur, no any abnormality detected. CNS normal, respiratory normal, GI normal, locomotor normal. So basically same story, only this that 25 years, non-hypertension, non-diabetes, recurrent episode of palpitation, 2 episodes with transient syncope, equally we have seizure, and it was found that normal, regular, here the regular with this. So we have investigated this patient, lot of possibilities, all blood reports are normal, chest X-ray normal, first ECG was showing normal, and when we initially first did the echo, it was found normal except RV was dilated. So RV was dilated, we returned, we had went back again second time probably in Kalyani, near Kalyani he was studying. There he have got the attack. We told them that at that time they did the ECG and that ECG was glitching. And we have a record.
Sir, if you got echocardiography right ventricle in problem,
Yes.
so hypoplasty right ventricle.
Yes, that is the
first possibility.
that is the RV was just borderline around 2.9. First time ECG was normal, it went back. Second time when we came with this, then we have thought that we have to go for some structural RV method. And Holter we did normal. This was the ECG. And this is the massive episode of the ventricular tachycardia of that. So this is the origin of VT, and it was treated. We are treated with IV Cordarone and metoprolol, and then we have planned to do for the MRI heart to rule out the structural heart disease of RV, right ventricle, and this was the ECG. Whether RV was normal 3.6, it is a significant dilated. This is the RV. This is the RV, and this is the LV. You see the RV size is exceeding the LV size. So what happened here? This is the RV is fibrosis, and it can be visually only through the MRI heart. It is the now increasing investigation for many methods, and where we see very thin part of that, various section on that, and it was the basically ARVC, arrhythmogenic right ventricular cardiomyopathy, and ARVC is the ideal, the triggering focus for the ventricular tachycardia, and it is the founding, and the name is ARVC, but it is found in the LV also. 5% case have. Last time our CSI one, Dr. Sahab had reported one ARVC of the left ventricle. So name is the misnomer. Even 5 to 10% LV can happen. Whether the normal cardiomyocyte is replaced by the fibrosis, fibrotic myocyte. That is the genetic defect on the, and this is the ARVC, and then EP study was done, and sir we have gradually, this is the final diagnosis VT in a case of ARVC, and IV this was treated, and after that we have put on the this is the ICD, and ICD was put on, and the last 3 years of our follow-up, the patient is asymptomatic, he has completed his engineering degree, got the job, and he is a normal boy. So two types of